Okay, good evening, everyone. Can you listen to me? Thank you, Mateo.
Yes, teacher.
Thank you. And can you watch my screen?
Yes, teacher, I can see.
Perfect. Okay. Well, today's class, we're going to talk about medical and paramedical personnel and places, okay? Maybe it will be a little bit different by country to another country, but I would like to tell me if there is any differences, okay?
Okay, Miss.
Perfect. Let's start with Jorge Brun. Please, could you help me to read in this part?
Sure. Good evening. Okay, medical practitioners. 1. A doctor who treats patients as opposed to who only does research is called a clinician. A doctor who provides primary care for patients is known as a general practitioner or family doctor, usually work in group practice, larger group practices in building called a healthcare center.
Thank you, Jorge. And as you can see, well, we have two sides, right? The one who is called a clinician and the other who treats a patient. But it seems to be that it happens that one of them make the research and the other one treats patients. Okay, I don't know if it works the same in your countries. Maybe Rina, I don't know if you're here. Or Melanie, what about Peru?
Hi, Miss, and everyone. In here in Lima, Peru, we have the two plans to attend the patient is similar. The for the clinical part and the uh, consultorios.
Okay.
So one part to practice is more with quirúrgico.
Okay, surgery.
Surgery, yes. And the other part is more interviews and questions. It's more about how is the symptoms, no? How what is the pathologies and more physical and just question. We have the similar of that.
Okay, thank you. Melanie, I don't know if you can help me out here, but in Bolivia we have the same size of practitioners. Maybe one side with the family doctor and the other the surgeon. Is that correct? Or we have more others?
Teacher, I believe in Bolivia we have a similar doctor. A general doctor is like a family doctor, but I don't know if in Bolivia we have a clinical, because I don't know if in Bolivia has research in medicine.
Okay, I think we have the research, but I don't know if it's common in every single hospital. Maybe one of the two bigger. I don't know. I don't know. Maybe mm, Carla. I'm sorry. Maybe Alison. No. Mateo. Mateo, can you help us out here?
Okay, teacher. So in Bolivia, we do have research physicians, but not as only research physicians. It's maybe it's a surgeon working in surgeries, doing attending patients, and as common labors and tasks.
Okay.
But the surgeon can have a research work too. While he's in his labor of being a surgeon, right? In
Okay.
some universities, I think the most universities, there are some institutes, institutes that are for research purposes specifically.
Okay, thank you so much. And I don't know if someone else want to add something. Or if there is some doubt, you can ask too. Because when I put my questionnaire, some of you says that you didn't understand everything. But here, we are here to practice and to ask questions, okay? If you have any doubt, please let me know. Okay, Rina, go ahead.
Good evening. I don't have a doubt, but I read the presentation, and I think in my country there are different. There are many differences about the concept about the medical practitioners. First is the meaning of the word, because in my country it's usually to use the term doctor and doctor and physician like the same meaning.
Yeah.
For something part in the history and the technician, but in the practical, doctor, physician is the same. We are the part of the clinical. We treat patients the same. So
Okay.
I think, yeah. And in English, yes, we use the different, because doctor is a person who study and in a title of or PhD. I think that is
Yeah.
the category of the doctor, because I know that a doctor in the clinical area and doctor in the laws, for example. And English, I think the most I read that is physician who for the people who treat patients. That is correct?
Yes, that's right. It is usually used the word physician to refer as a doctor, as a clinician, but in Spanish it will be médico, right?
Yes.
And not as a doctor, like a PhD maybe. But we in Latin America we use the whole time doctor as a physician, right? Is what you say. Okay, so that's correct. But here, for example, we have a family doctor, right? So it is used, but it's not so common. Okay, it's correct, or it's better if we talk about a physician. Okay, thank you, Rina. You are from El Salvador, right?
Yes.
Perfect. I don't know if anyone has any other question here. Carla. Hi, Carla. Do you have any questions?
No, Miss, sorry, I have a problem with.
Okay,
Mhm.
no worries. Okay, then we have here, and Carla, please help me here.
Specialties? Okay, specialties doctors, for example, pediatricians, generally works in hospitals who work outside the NHS, providing private, private, private health,
Private.
private,
Uh-huh.
okay, health care, may have consulting rooms outside a hospital.
Okay, thank you. Okay, let's talk about specialties. Specialties doctors, for example, pediatricians that are the doctors who are specialists on children, right? Generally works in hospitals. Who work outside the NHS, that is a National Health Service, is providing private health care, okay? May have consulting rooms outside the hospital. Maybe, I don't know, but is there anyone who has a consultation outside of the National Health Service in your countries? Or anyone works for a National Healthcare Service?
Hi.
Hi, Carla.
Hi, how are you doing? Here in Ecuador, we have some specialties. Family doctor is a specialty.
Okay.
So I studied for 3 years to be a family doctor after being a doctor. And I have my own consulting room, a private consulting room.
A private one.
Yes.
And you work with the National Health Service
No.
or just private?
Just private.
Okay. Okay, that's so good. Maybe there are some people that, or some doctors that works with a National Health Service as well as they work private. Okay.
Yeah. Here in Ecuador, you can
But,
work in the.
that's good. Both.
Yes.
Okay. Thank you, Carla. Is there any question here? No questions? Oh, sorry. Okay. Okay. Sergio Burgoa.
Yes, Mrs. Tina. Hi.
Can you read this part, please?
Sure. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. And note, names of specialties usually end in ology. Names of specialists usually end in ologist. If the name of specialty ends in IES, the name of the specialist ends in Asian. There are some exceptions. For example, anesthetics and anesthetist.
Thank you. Thank you. That's right. Can you see the box? A cardiologist specializes in disease of heart and circulation or cardiology, right? A geriatrician will specializes in diseases of elderly patients or geriatrics. An anesthetist, that's the exception, is a specialist in anesthetics, okay? But we have the note below. Names of specialties usually end in ology, most of them. And names of specialists usually end in ologist, okay? If the name of a specialty ends in IES, the name of the specialist ends in ISIAN, okay? And we also know there are some exceptions like we already saw. Okay, is there any question here for vocabulary, or you have one example maybe that you wanna share with us? No questions?
Sorry, I have a question.
Yes.
I don't know how you call por ejemplo, no terapia intensiva, intensive care o no sé.
Intensive therapists.
Intensive
But
therapist.
I'm pretty sure that there is another name for that or another synonym. Okay, that's a good question. Let me check. Yeah, intensive therapist, because intensive therapy, it will be the specialty. Okay?
Okay, thank you.
If you find out another synonym or name for this specialty, please let us know, okay? We have the next classes to talk about it. Thank you. Okay. I will read this part. I don't know if you can see it very well. Can you see it?
Yes, teacher.
Okay, Mateo. Okay, Mateo, can you help me reading this part? Maybe the first paragraph, if you can read. If not, please let me know. I will read it, okay?
Of course. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I'd certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I've assisted at operations several times, and I've even done some minor ops by myself. But surgeons have to be able to do the same thing again and again without getting bored, like trying off cut arteries and so on. I don't think that would be a problem for me, but they need to make decisions.
I'm sorry.
Okay, don't worry. They need to make decisions fast, and I'm not good at it. I like to have time to think, which means surgery is probably not right for me.
Okay, and you?
Do I finish the reading?
Yes, please.
Note, the collocation good with is followed by a noun. He is good with children. The collocation good at is followed by the ing form, gerund, of a verb or by a noun. She's good at explaining procedures. She's good at explanations.
Okay, thank you. Okay, well, as you can see and understand, this part is like a resume of what does she want to specialize in. Okay, maybe you have some other specializations that you want to go into, right? And let's check this note. The collocation good with is followed by a noun. He's good with children. The collocation good at is followed by the ing form or gerund, okay, of the verb, or by a noun. Like an example, she's good at explaining procedures, or she's good at explanations. Okay, so I don't know who's going to share with me or with us what kind of specialization do you want. We have one, I think it was Rina, maybe, that is a family doctor.
No.
No, who's the family doctor? I'm so sorry, Carla.
Yes.
Okay, thank you. Another one. Jethro.
Yes, teacher.
What would be your specialization?
I would like to do surgery.
Surgery. Okay, thank you. Andres, what about you?
I would like to specialize in neurosurgery.
Okay, you want to be a neurosurgeon, right?
Yes.
Wow. Okay, thank you. Weimar, what about you? Ricardo, are you here? Okay, Jocelyn. Alejandra, what about you? Carlita.
Well, I want to be a dermatologist. I prepare for the resident exam, and I want to be there. I want to do the resident here in Bolivia.
Okay, thank you. Thank you. Then we have Carla.
Well, I would like to be ophthalmologist.
Okay. Thank you so much. Valeria Mercado.
Hi, well, I'm not 100% sure, but I am thinking about ophthalmology or anesthesiology, but I'm not sure.
Okay, thank you. What about Sergio?
Just like Jill, I haven't decided what to specialize in yet.
Okay, but you
very,
have something?
yeah, I'm very attracted to endocrinology,
Wow.
maybe intensive care. But yeah, just like that, this example, I think I need more experience. So
Okay.
that's I have a
Thank
clear
you.
idea of what I want.
Thank you so much. Well, that's so interesting because you have a lot of variety here and you just can choose. I have a doctors in every specialization, right? Okay, that was so good. I don't know who else. I didn't ask everyone. Who is missing?
Probably me.
Okay, Rina, please let me.
I am already a physician, but I think I'm stay like in my country I'm sorry, doctor médico general.
Okay,
General
practitioner.
General practitioner.
Yeah.
Okay, general practitioner, because for me, in my opinion, I like to attend a different kind of patient. I am not like I don't like the idea to attend only kind of situation in the medical area. So I think in fact, I am studying already in a master, but I really like to study another master about the medical area.
Okay, that's so good. So you told me you were a radio physician?
I'm sorry, I can't hear you.
Sorry, what was your specialty?
I am a general practitioner, but I am work right now like a teacher. I am a teacher in a university.
Oh, okay, okay. I listen. So I missed some things. Okay, thank you. Who else? Maybe Weimar. I don't know, Weimar, if you're here. Well, he was at first. Okay, let's go. Carla Calle, can you read this part, please?
Yes. Medical practitioners too. Hospital staff. The people who works in any type of workplace, including hospitals, are called the staff. The pre-registration house officer, PRHO, or house officer is a newly graduated doctor in the first year of the postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name of this junior doctor is Foundation Year 1 Doctor. FY1.
Yeah, okay. This might be used in Europe, okay, and in the United Kingdom, more or less, okay. But it results to be for us like a residency, right? Resident 1, resident 2. I don't know. Maybe we have 4, resident 4. Before we would get our specialty. Am I right?
It depends the specialty.
Okay.
Yes, it depends. It depends the level of the specialty too, because at the first, for example, if you want to be a surgeon, you have to study 3 years, resident 1, 2, and 3. But after that, you want to be a ophthalmologist, for example, there appear resident 4, 5, and 6.
Okay, so those are a lot of years, right?
Yes.
Perfect. But I wanna give you the idea that these doctors that go to the foundation year 1, it's almost the same as residency. Okay, so you can get related to that. Okay, I don't know if you have any question here or if it's clear to you.
Sorry, I have a question.
Yeah.
Do you know if this works the same in the US,
Sergio.
or is this just
Sergio.
for the
Um, mm, let me check out. Not for today, but
I
for
could
the
help
week's
you with that
class.
if you want.
Yeah, please.
Yes, in the US, it works like PGY and the year. For example, PGY1 is because it's postgraduated year one, and that's how it works. I think the specialties are like take more time in the US. For example, pediatric surgery or neurosurgery take like 7 years. So you get like PGY1 from PGY1 to PGY7.
Wow. Wow. It's there are a lot of years more. Maybe I don't know, Jorge, but maybe when you homologate your papers into the USA, you have to study the first year English, then a basic course or something, and then get into the residency.
Actually, they assume you know English because you for your English, it's called ECFMG.
Okay.
So you can you take the steps. You have 3 steps to take. The first one is step 1 is basic science step. The second one is clinical knowledge, and the third one is like you can take it there. But to get an ECFMG, it is a certification that allows you to work as a physician there. You gotta pass step 1 and step 2 CK. Some hospitals ask you to have the TOEFL passed, but there are a lot of requirements too. For example, you must have experience in the US, you must have letters of recommendation, and yeah, I think that's enough for applying for residency. I think it's the toughest in the world.
Yeah, that's why it's a little bit difficult, right? But
Yeah, it takes
it's
time.
not impossible. Okay, thank you so much,
Oh, you're
Jorge.
welcome.
Thank you.
Sergio, I don't know if you solved your doubts.
Yes, yes, absolutely. Thank you, Jorge. Thank you, Ms. Encinas.
Thank you. Perfect. Let's continue then. Oh, okay, who's gonna help me here? Jethro.
Yes, teacher.
Please help me out here.
Okay. A senior house officer, SHO, is in the second year of the postgraduate training. The title is now Foundation Year 2 Doctor, but the old terms senior house officer and SHO are still used.
Okay, thank you. Okay, then a senior house officer or SHO is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor or FY2, but the old terms senior house officer and SHO are still used. So both are the same or are synonyms, okay? And it can be used like a residence too, maybe in this case. Okay, is there any question here?
No, clear.
Okay, I think it's pretty much understand. Unless you want to go to study there, of course, and you will find out more information about this, okay? Well, Jocelyn, are you here? No. Weimar? Nothing. Okay, Valeria Mercado.
Yeah. A specialist registered SPR is a doctor who has completed the foundation program and is training in one of the medical specialties. These are also some non-training registrars doctors who have completed their training but do not wish to specialize yet.
Okay, thank you so much. So there are also some non-training registrars, okay? And those are doctors who have completed their training but do not wish to specialize yet. Okay. Then, Andres, can you help me?
Yes, teacher. A consultant is a fully qualified specialist. There may also be some associated specialists, senior doctors who do not wish to become consultants. In addition, there is a last one medical or clinical director who is responsible for all of the medical staff.
Thank you. Okay, so we have a consultant is a fully qualified specialist. There may also be some associate specialists, and those are senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director, okay, who is responsible for all of the medical staff. Okay, so there will be something like the administration side or part. Maybe some doctors, like me, for example, are specialists on public health and maybe took care about the administration part. Okay, that's why they say there may also be some associate specialists, are senior doctors who do not wish to become consultants, okay? But there is at least one medical or clinical director, okay? Is there any question? Okay. I don't know who can help me to read this part. Jorge, maybe?
Sure. Okay, medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams, which consist not only of doctors, but also of physiotherapists and other allied health professionals. When patients enter or are admitted to a hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment and care. The junior doctor clerks them, takes their medical history, and examines them. Sometime later, the registrar also sees the patients and may order investigation or tests, for example, x-rays or an ECG, make a provisional diagnosis, and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds. When the management of the patients is discussed with the registrar, consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care.
Thank you so much. Okay, let's make a little resume, okay? Each consultant has a team of junior doctors to help care for those patients in many hospitals. Okay, there are multidisciplinary teams like we have in our countries, I think, which consists not only of doctors, but also of physiotherapists and odontologists most of the time, right? For example, here we have a team that involves an odontologist. Okay, and other allied health professionals. When patients enter or are admitted to a hospital, they are usually seen first by one of the junior doctors on the ward, okay, where they will receive treatment and care. I think it's almost the same in every single country, right? Let me know if I'm right. When patients are first admitted, they are received by junior doctors on ward where they will receive the treatment and care. That's right? What about El Salvador, Rina?
Yes, for example, there is a patient in the emergency room. The first person or the first doctor who attend that person is a junior or a resident one, and depends what the kind of emergency. It's a medical emergency. Is the resident one of the
residency.
Physician or the medicina interna, medicina, the medical area. And if the patient is because have a trauma, for example, or appendicitis or something, surgery emergency, is the junior physician of the surgery in the surgery area. So depend of the kind of the emergency.
Okay, thank you, Rina. What about Melanie? What about Peru?
Yeah, Miss. Here in Peru, for example, in emergency, receive by a resident doctor in triage to evaluate the type of case, if it's an emergency or urgent. And depending of that, it's treated by a specialist or perhaps an intern. So depend of that.
Okay, thank you. And what about Carla in Ecuador?
Here, it depends. Here in Ecuador, as in like Peru, we have the triage area. And if it's something for, I don't know how to say it, ambulatory, some ambulatory disease, it is treated in the triage area. But if you have some complicated disease, you have to get admitted to the hospital. So then in the emergency room, they try to I don't know how to say this, resolver. To resolve the emergency. But if you don't have an emergency, you have to go to this here in Ecuador, with how it works
I'm sorry.
In Bolivia.
I lost you a little bit, the last part.
Primary care.
Can you repeat the last part, please?
Yeah, if it's an emergency, it is treated in the hospital. But if it's not, you have to go to the primary care.
Okay. I lost you, Carla. Ale, do you want to say something?
I have a little question. I don't know if the Dr. Junior is the same like internship.
Yes, it might be, because it says the junior doctor clerks them. It's like they take their medical history, they take their personal history, right? And examines them at first, and then he will send it to the doctor or the other physician that that needs to be treated for. Okay, so it might be.
Okay, thank you.
Thank you. Carla, are you here again?
Yes,
Okay, I lost you by the signal. I'm so
I
sorry.
think my internet is bad.
No worries. But if you wanna finish your idea, it would be awesome. Okay, I think we lost her. I don't know if you have any questions here for a vocabulary, since we don't have enough time to explain everything. Do you understand the meaning of word rounds?
What round would be like el turno de piso del servicio, por ejemplo, medicina interna.
Yeah,
Maybe.
yeah, that's right. They are like places or salas, right? Where you can make some rounds with the physicians, the different physicians. Okay. Another word maybe that it wasn't understood. I think it is pretty much clear, right? But if you have any questions, you can ask, okay? Okay. Mateo, are you here?
Yeah.
Help me out with this part, please.
Okay. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. 8 hours every day.
Hours, sorry.
Yeah, hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. to the next day. After a week, they change to a different shift, for example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. easily every day and take turns to be on call, available to return for the hospital if necessary, from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio pager
Yeah.
or bleeper, a device which makes noise when someone is trying to contact them.
Okay, thank you. Yeah, that's right. Okay, the alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. What does it mean to be on call? It means that the physician or doctor are available to return to the hospital if necessary. For example, from 5 p.m. to 9 a.m. the next day, okay? Days on call are set out in a rota or list of names and times. Doctors on call carry a radio pager or bleeper that it results to be this device here, okay? Which makes noise when someone is trying to contact them. Okay, is there any question here? Okay, is there anybody that makes some shifts at the hospital? Nobody?
No.
No.
That's the reason why I study family doctor.
I'm sorry, what is the question, teacher?
That if there was anybody that works in shifts, that makes shifts at the hospital.
Yes.
Yeah.
Yes, because during the career when I was a student, between the 4th year and the 8th year of the career, I have to work in the different area of the hospital in the country. The hospital is the third level of attention. That is mean that I have to attend. It's the highest hospital. Then you have to send the patients. For example, that is a patient is very complicated. You have to send in a hospital in the third level of attention. So it's the area of the different specialists. So like a student, yes, I have to work, but that schedule, I am jealous about that schedule because I don't have an schedule when I was a student. I don't know how I lived in that time, but yes, during when I was a student, I had to work like that. It was very interesting, but like Carla, I don't want it. I don't like it.
Okay, Rina, thank you. Yeah, that's right. I think you have the worst shifts ever when you are students.
Here in Ecuador, we have 30 hours.
30?
30. 30, and well, I worked for 5 years like a resident in intensive care unit. So the shifts, ¿cómo digo, duraban? The shifts,
they were during?
They were during for 30 hours. And during my specialty, I have to do 12 hours shifts after 8 hours of work. So when I finished the specialty, I decided to never do a shift anymore.
Again? Okay, I can understand that. That's so hard. What about in Bolivia? I don't know, Jorge, Sergio, Carla. What about you? Did you make some shifts?
Yes, I did during my 6th year of medicine and my last year. And yes, I worked in shifts. They were very harsh. They were very, very hard and very stressful, like very, very lots of stuff. I have very bad and good memories about that time. So yes.
I can imagine. Okay, guys, you work so hard on your careers. Okay, let's continue. We will finish, I think, with this part. Okay. Nurses. Nurses grades working in a hospital have the following grades. A student nurse, a nurse who is still in training, staff nurse, a nurse who has completed the training course, charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department. Nurse manager, a nurse who is in charge of several wards. Okay, we have a little note here. The old sister is still sometimes used for a female charge nurse. A female nurse manager may be called matron. Okay, and here's where we have a little bit confused. Okay, because I don't know if you have heard the word matrona. I don't know if you listen some day in a, maybe, I don't know, in a little place where you make your social or rural time, this word matrona. Have you heard about that?
Here in Ecuador, we have the la obstetriz.
Okay. Matrona, never? You never heard about that?
No.
Yes,
Okay.
I have heard of Matrona during my rural rotation. Is a woman that helps pregnant women to give birth.
Yes, it's almost used like partera, right? But it results to be a most experienced nurse, okay? It's not the one who has a title like that, but it's the most experienced one. It's kind of, okay? But it will be your homework for the next class, that it will be on Monday, our theoretical class, okay? That you find out a correct significance for matron. Is it okay?
It's okay.
Okay, perfect. We're gonna finish here. Don't go yet, please. I will send to you my questionnaire, and I want you, please, everyone, to fill it, because I need to take a picture with the whole number. So please. Can you see my questionnaire?
Not yet.
Not yet.
Okay, I think now
It's
you
okay
can.
now.
Okay, please fill it for me while I take the picture, little picture. Okay, who is getting out and getting? Please fill my questionnaire. 5, 9. 3 more. I think I need 3 more. We have 10, 2 more.
I don't know. It doesn't allow me to send the questionnaire.
Don't worry. You just have to fill it. If not, please take a picture and send it to me. If you cannot send it, okay? Send it to me by the private number, please. Okay, 10. One more. Who is left?
I think I'm missing, but I cannot submit it.
Yeah, but you are the 11 maybe. Oh, one is left. Okay, it will be okay. Smile, guys. I'm just kidding. Okay. Yeah, that's good.
Okay, done.
Okay, thank you so much. Thank you so much. And see you tomorrow, okay? I will send it to you, well, if you forget about the schedule, I will send it to you, the schedule that you choose, okay? Just to let you know. And tomorrow we're gonna start with the 50 minutes of practice, okay? Okay, guys, thank you so much. Have a good evening. See you tomorrow then.
Okay, you too.
Bye-bye.
Thank you. Good night.
Tomorrow.
Thank you. See you tomorrow.
Bye, teacher.
Goodbye, teacher.
Bye.
Sí.
Nelicita. Hola, Nelicita, perdón, me has llamado a contestar.